Veteran Bollywood actor Rishi Kapoor passes away in Mumbai at the age of 67. Centre allows interstate movement of stranded people including migrant labourers. New guidelines to fight COVID-19 to come into effect from May 4. COVID-19 death toll in India rises to 1,074 cases at 33,050. Well, hello viewers, welcome to News and Trends. You're watching the Daily News Bulletin with me, KV Nurumi. Veteran actor Rishi Kapoor passed away in Mumbai today. He was 67. He had been admitted to a city hospital on Wednesday. Rishi Kapoor received the National Film Award for his debut role as a child artist in his father Raj Kapoor's 1970 film Mere Naam Joker. He had his first lead role as an adult opposite Dimple Kapadia in 1973 with the film Bobby and received the Filmfare Best Actor Award in 1974. He played leading roles as the romantic lead in many films between 1973 and 2000. The actor returned to India last September after undergoing treatment for cancer in the US for almost a year. The government has issued an order to states and union territories to facilitate interstate movement of stranded people, including migrant laborers in the country. Home Ministry said in its order that all persons must be medically screened at source and destination and kept in home or institutional quarantine on arrival as per the Health Ministry's guidelines. All states and union territories have been asked to designate nodal authorities and develop standard protocols for receiving and sending such stranded persons. The nodal authorities shall also register the stranded persons within their states and union territories. The moving persons would be screened and those found asymptomatic will be allowed to proceed. Buses will be used for transport of groups of persons. The buses will be sanitized and shall follow social distancing norms in seating. The states and union territories falling on the transit route will allow the passage of such persons to the receiving states and union territories. On arrival at the destination, such persons will be kept in home quarantine or institutional quarantine based on the assessment of local health authorities. They would be kept under watch with periodic health checkups. They will be encouraged to use Arogya Setu app to monitor and track their health status. Meanwhile, the Home Ministry has said that new guidelines to fight COVID-19 will come into effect from 4th of May, which shall give considerable relaxations to many districts. Home Ministry spokesperson said that details regarding this shall be communicated in the days to come. The Ministry on Wednesday held a comprehensive meeting on the lockdown situation. There has been tremendous gains and improvement in the situation due to the lockdown till now. Home Ministry spokesperson said to ensure that these gains are not squandered away, the lockdown guidelines should be strictly observed till 3rd May. The death toll due to the novel coronavirus pandemic rose to 1,074 and 66 more fatalities, and the number of cases climbed to 33,050 in the country on Thursday, according to the Union Health Ministry. The number of active COVID-19 cases stood at 23,651, while 8,324 people have recovered and one patient has migrated. The total number of cases include 111 foreign nationals. The ministry said the doubling rate is now at 11.3 days in the last few days. Mortality rate in India is 3% compared to the global mortality rate of 7%. The Meghalaya government today declared 10 of the state's 11 districts as green zones and allowed inter-district movement there, an official said. The decision was taken as no COVID-19 case was reported from these districts, he said. All the 12 COVID-19 cases in the state, including one death, have been reported in the state capital that falls under East Khasi Hills district. Barring East Khasi Hills districts, all other 10 districts in the state are in the green zone as they have not reported any COVID-19 cases. All deputy commissioners in the green zone may allow inter-district movement, Political Department Secretary Cyril V.D. Dengdo said in a letter to the district magistrates. The inter-district movement has been allowed in the green zones on the condition that people do not transit through East Khasi Hills district, he said. All the central government officials, including the outsourced workforce, have been directed to immediately download the Arogya Setu app on their mobile phones. The decision has come amid concerns raised by experts on the privacy of the application. The officials, through an office memorandum on Wednesday, have been told by the Department of Personnel and Training to review the status on the app before starting for office and commute only when it shows their status as safe or low risk. In case the app shows a message that the official has a moderate or high risk, calculated on the basis of Bluetooth proximity, recent contact with an infected person, he or she should stay away from office and go in for self-isolation for 14 days till the status becomes safe or low risk, the order states. The global tally of confirmed COVID-19 cases has gone up past 31 lakhs. Over 2 lakh people have died. The United States is the worst hit with over 60,000 deaths, followed by Italy, Spain and France. The United States recorded 2,502 coronavirus deaths in the past 24 hours, according to the latest real-time tally yesterday as reported by Johns Hopkins University. After 2 days of a relatively easing in the total on Sunday and Monday, the numbers have spiked again the past 2 days. At least 60,853 people have now died in the United States, according to the Baltimore-based university. Spain has 2,36,899 cases with 24,275 fatalities. Italy has recorded 2,03,591 cases with 27,682 deaths. France has so far 1,66,543 cases and 24,121 fatalities, and the United Kingdom has recorded 1,66,441 coronavirus cases and 26,166 deaths. Commissioner and Secretary and Convener Empowered Group Dimapur District Y Kekhato Sema held a meeting with various Samaj in Dimapur to discuss issues relating to arrangement of quarantine facilities in the district for stranded people of Nagaland who will be returning to the state from different parts of the country post-lockdown period at Hotel Saramati today. Briefing the gathering about various measures that are being taken up by the government to stop and contain the spread of COVID-19, APC maintained that Dimapur, being the gateway of Nagaland, has huge responsibility and special attention was also given by the government in fighting the pandemic. Seeking the cooperation of everyone, Kekaro said that administration, police and medical alone cannot fight the COVID-19 pandemic. Highlighting the ongoing preparations of quarantine facilities for stranded people, he informed that the committee has identified some government-owned buildings as quarantine centers where renovation works have already started. The convener also sought suggestions from different community present in the meeting besides the place and number of people from their community who are willing to come to the district so that proper arrangements can be done accordingly. All the representatives present in the meeting assured all possible help such as their community-owned buildings which can be used as quarantine centers for people from their community under strict supervision of medical department and police. Marwari Samaj and Punjabi Samaj came forward to bear all the expenditure for the community during the quarantine period. Following reports received from the public about price rise, especially cement, Deputy Commissioner Dimapur Anup Kinchi has cautioned and warned that strict action would be initiated against the defaulters. He said this during a meeting convened by him with the district-level price monitoring committee in the conference hall of DC Dimapur today. DC Dimapur directed DMC and administrative officers to take strict action and book those persons who are indulging in price rise. The Directorate of School Education has notified for information to all concerned that the Department of School Education would commence telecast of video lessons on important subjects in classes 8, 9, 10 and 12 through Doordarshan Kohima from 1st May 2020 for compensating the loss of instructional days caused due to the ongoing lockdown. The lessons will be broadcasted through All India Radio AIR from 2nd May 2020. All the DEOs, senior SDEOs, SDOs have been directed to disseminate this information to all school heads under their jurisdiction with instructions to pass on the information to all parents and students of respective schools. As ensuring maximum coverage for the Doordarshan, DD satellite telecast and AIR broadcast across the state, including the remote areas, is very much essential for achieving the objectives of the program, the concerned officials have been directed to coordinate with the district administration so as to make necessary arrangements for students who do not have the facilities to access the DD satellite telecast at home to view or listen the broadcast at a common place like village hall, school auditorium, etc. The broadcast schedule is made in such a way that only 2 classes will be having the lessons on a particular day, so that children will not group up in large numbers in schools, village council halls where telecasting is viewed. The Home Department has issued an advisory in connection to Department of Animal Husbandry and Veterinary Services notification whereby a ban on import of pigs has been imposed throughout the state in view of the outbreak of African swine fever in neighboring states. It is strongly advised to the general public not to hunt or consume any wild meat, especially wild boar, civet, etc., since there is a strong possibility of the virus being present in such wild animals. All deputy commissioners have been requested to bring this to the notice of all village councils. Let's now take you to Kohima, where the briefing is being made on the status of COVID-19 in the state.
As on today, a total of 653 samples have been sent for testing from the state. Results of 640 samples have been received and all are negative. The results for the remaining 13 samples are awaited. Today, a total of 1,755 persons have been screened and a total of 33 persons are under facility quarantine. As regard the level of preparedness in health sector, I would like to inform that there are 12 dedicated COVID-19 hospitals in the state equipped with 25 ventilators having a total capacity of 464 beds along with 48 ICU beds. We also have 117 isolation beds in these hospitals for suspect cases. For the purpose of transportation during medical emergencies, we have 99 government and 40 private ambulances in the state as on today. I would like to inform that the number of people of Nagaland stranded or in distress outside the state due to the nationwide COVID-19 lockdown who have been given cash assistance has risen to 7,114, comprising of 4,476 working people, 2,522 students and 116 patients.
And with that, we come to the end of this bulletin. Do subscribe to us on the YouTube channel and also follow us on Facebook and Twitter. Do stay tuned as we try to bring you lots more of these news and updates through this medium. Meanwhile, we request you to take cognizance of all the directives issued by the government from time to time to contain the pandemic. Stay home and stay safe. From all of us here, it's bye for now and thanks for watching.